Doctor, we can start, doctor.
Yeah. Good evening, all. I welcome you all to yet another session of Ayurvedic perspective of clinical nephrology, a guna-based perspective. I hope this evening would be another feather to the cap in addition to the Ayurvedic perspective of clinical nephrology. I welcome Dr. L. Mahadevan sir to continue the session. Before that, due to some unavoidable circumstances, I am unable to be in the session for a longer time. So I request Dr. Abhishek to start the session.
Dr. Abhishek. Dr. Abhishek, to start the session.
Hello. I welcome every participants. I welcome Dr. L. Mahadevan sir to start the session. Sir, over to you, sir. You can start the session, sir.
Today we are going to talk about renal failure. As such, there is no direct reference about renal failure. Already we have discussed in the previous classes. We have incorporated the approach of management of renal failure from many chapters. Udaram, Gulmam, Soham, Pandu. So among the Sampraptis, we have discussed Malasanchayam, Kavaigunyam, Dadabhagam, Srododushti, Agrimandhyam are the basis, Kledadushti, Abhishanti. When the kidneys fail to function adequately, renal failure happens. It is acute or chronic. Always there will be elevation of creatinine. Acute renal failures, accidents, injuries, complications from surgery, certain drugs, painkillers, NSAIDs, aceclofenac sodium. A single tablet can produce renal failure. Chemicals, antibiotics, chemotherapy, electrolyte imbalance. So malasanchaya, kapham is malam, pittam is malam, malarupam, they have malarupam also. Vadam does not have a malarupam. Doshapakam is good, Dhatupakam is ill health. Chokachikissa and Pandachikissa go hand in hand. Chronic diabetes, that is why in every case of diabetes, you should always check creatinine, potassium and urine microalbumin in a periodical interval. Hypertension. We want to talk about hypertension elaborately because what is the approach of management of this hypertension? From which condition you will derive the principles? Somebody is giving some Toya Kalpana. Is Sarpagandha a real solution for all forms? Do you have a Vata type, Pitta type, Kapha type in hypertension? Whether it is a Gudalinga Vyadi, Avyakta Vyadi, Vyadi without Lakshana or manifestation. Then polycystic kidney disease. What will you do if you diagnose? If they ask you, can I marry? What will be your answer? Like a HbSAg patient, come and ask an Ayurvedic doctor, sir, can I marry? What will an Ayurvedic doctor answer? Some people believe hepatitis C carrier and B carrier are curable with Padola Kaduroginyadi, Padola Muladi, Drakshadi Rasayanam, G-Mudanasyam, etc. Aspirin, Brufen, acetaminophen. Acetaminophen is our paracetamol, phenacetin. Paracetamol is a safer drug, but more than 4 grams can produce hepatotoxicity. So, when urea is elevated, there will be vomiting, diarrhea, nausea, more urination at night, more than 2 times. Foamy urination, less urination, small amounts of urine, color change, hematuria, pressure in urination. When phosphorus increases, there will be itching, damage to the bones. We call it renal osteodystrophy. When potassium increases, why we use Saindavam, I will talk in the end. Why Saindavam is a better salt than other salt. It came from Sindhu Desham. Sindhu is in Pakistan now. But Saindavam is available everywhere. Kasturi is not available, but Kasturi Guliga is available. Korojanadi Guliga contains the horn of rhinoceros, so not the ingredient. But Korojanadi Guliga is available. If you take these things, in Wildlife Protection Act, they will catch you and put you in the jail. So hyperkalemia. Usually an Ayurvedic doctor suffer to treat sodium and potassium issues. That is hypernatremia, hyponatremia, hyperkalemia, hypokalemia. They struggle. If it comes to chloride and bicarbonate, then it's gone. That because that cases they have not seen. Arterial blood gas analysis, metabolic acidosis. Even in Vardhamana Pipali, they have told Kimshugabatra Ksharam and sheep's milk has to be added. And Charaka Vimanam, first chapter, they say Ksharam Lavanam Pipali should not be given more than 15 days. These are all the hints of metabolic acidosis. How to prevent it with an alkaline substance. So, abnormal heart rhythms and potassium, you should know. Swelling in the legs. In Sankarakam Sutram, while describing the Ama, Akshikuta Shotaha is told. Akshikuta Shodam is classically seen in nephrotic syndrome, which in modern medicine they call it periorbital edema. Exertion dyspnea due to pulmonary edema, polycystic kidney disease, pain in the flanks, hemoglobin will be low, urea will be high, creatinine will be high, potassium will be high, calcium will be low. Sugar depends on the history of diabetes, urine PCR, protein creatinine ratio 0.28, 0.28. If it is greater than that, that denotes renal damage. You can see the size of the kidneys in ultrasound, which is a very safe procedure. So, Udara Chikitsa, Agni Deepana Chikitsa, Aruksha Virejana, Mutra Shodhana Chikitsa should be given. Amount of urine, previous day output plus 500 ml of water. That you should remember. In the fluids, drava, which includes the milk, water, kashayas, water needed for swallowing the tablets. You cannot randomly boil barley water with gokshura and ask them to drink. Already the fellow is unable to eliminate the urine. So dosage should be limited in oliguria, 1.2 liter water, 3 grams salt. Anuria, salt restriction is more. Polyuria, moderate salt restriction. Anuria, we give virejanam with bhunimbam mahaushadam. Polyuria, gokshuram, sadavari, yukshurasam, bhala, kushmandam are given. Rukshavasti is given in anuria. Shilajit is avoided because even Chandraprabha is not effective many times because we don't get good quality of Shilajit. Still, it is a pity that students study Swarnatapi Shilajit, Tamratapi Shilajit, Rajadatapi, Logatapi and all. We buy from Punjab and Jalandhar. கீழ் மாதிரி ஒரு ஐட்டத்தை தரான். என்னது இருக்குன்னு பகவானுக்கு தான் தெரியும். ஃபல்விக் ஆசிடுங்கிறான் கேட்டா. ஸோ புனர்னவாதி கஷாயம், குடூச்சியாதி கஷாயம், பத்யா புனர்னவாதி கஷாயம், அஜாஜி பாடாதி சூர்ணம், பூனிம்பம், சுதர்சனம், நாராயண சூர்ணம், ரூக்ஷ விரேஜனம், அயப்பாத்திர புனர்னவா, புனர்னவ அய லேப்பம். It's available in Vaidyaratnam, a very good product. Punarnava Aya Lepam. We have it here. Dugdhavadi, Vaishyajaratnavali. My Guru Vaidyanathan sir used to write that. Dasamola Haridegi, Kamsa Haridegi. Kamsam is a quantity around 3 kilos. Sukumar Lehyam, which contains Trina Panjamulam, which is a Mutrala Dravya. Kalyanaka Gulam is for Virejanam. Punarnavadi Manduram. These are all the medicines. Now entering into diabetic nephropathy, somebody asked the last class. Diabetes Havipraso Pramega Kushtanam. It is one of the disease among the Maharogas which was almost genetical level, up to genetical level documented by Acharyas. You see, Charakam Sutram 70 Skenda Sharasiyam, Avaranajanya Pramegam, Pramega Padaga is told. Then there is separate Nidanam, Samprapti, Rubam, Upadravam of Pramegam. Then Chikissa of different Pramegam. Sandarpana Janya Pramegam, Charaka says that is the type 2 obesity, 40-45 years it's coming. Asya Sugam, Sopna Sugam, Dadini, Gramya, Udagano, Varasaga, Pramsi. It is Viprakrishta Hedu. 18th year you start your sedentary life. 40th year you get diabetes. The incubation period for the manifestation of disease, it takes a long time. And there is a beautiful concept in Charaka Nidanam. It is Sarva Vigara, Vigada Bhava Bhava Prativishesha Abhinirvritihi Bhavanti Hedu Ityuktaha. Very 25 marks question in MD. So I am not going to elaborate that. You see the Susruta Samhita, 4 chapters. 4 chapters in 186 chapters are dedicated to diabetes spectrum. Nidanam, Chikissa, Pramega Pitaka, diabetic carbuncles and dermatosis, one chapter. Madhumegam, separate chapter. Madhumegam is a separate chapter in Susruta. That made this thing interesting. Susruta gave some megas. These megas, the 20 types of pramegas, we have some megas are classical endocrinal. For example, madhumegam endocrinal, insulin related. Some are nephrological, albuminuria. Some are urological. Outlet obstruction producing some changes like hastimegam, padamegam. Some are endocrinal, metabolic, nephrological, urological, neurological. Shanair megam, little by little. Probably the Shanair megam looks like atonic bladder with overflow incontinence. So Suramegam, Susruta says acidic urine. Why the urine becomes acidic? That is the question. Lack of water and other causes. Phenamegam, phosphaturia. Small children, neonates, they pass urine. Mother will come and say, there is white sedimentation in the floor. Then Lavanamegam, Amlamegam. These are new. So near possible correlation. Udagamegam, I thought it is insipidus. Insipidus is a very rare entity. Even in 23 years of practice, I would have seen around 2 to 3 cases. Recently, we saw a case of boy with polyuria, 60 times urination. From Andhra, he went away. So, Udagamegam, undifferentiated polyuria will be the apt word. Ikshumegam, renal glycosuria. The renal threshold, blood will be normal, urine leak will be there. Renal threshold vary from 60 to 320. But usually when sugar crosses 180, you get sugar in the urine. Sandramegam, phosphaturia, suramegam, acidic urine, pishtamegam. Pishtamegam looks like proteinuria, gross proteinuria. Shukramegam, spermatoria. Sikatamegam, crystalluria due to stone. Sheethamegam, alkalinuria, UTI. Contamination can produce. Shanairmegam, atonic bladder. Lalamegam, prostatic secretions, urological. It's urological. Ksharamegam, the Paitiga pramegam, I feel. Paitiga pramegam is a spectrum of painful and painless hematuria of various origin. Paitiga pramegam is identified with color. Light yellow, dark yellow, red, brown, and like ink. Manjishtamegam, they say. So Ksharamegam is alkaptonuria, actually, inborn error of metabolism where the urine will be black. Neelamegam, exercise. I have not seen Neelamegam. Kalamegam, I have seen. Vesicular hemorrhage due to transitional cell carcinoma, I have seen. Haridramegam, of course, when bilirubin crosses 5 or 6, hyperbilirubinemia, you get that. Manjishta Megam is painless hematuria. Raktamegam can be systemic causes also due to low platelets, prothrombin time elevation, or some coagulation problem, aspirin toxicity. Nowadays, you see people who take clopidogrel, they come with hematuria. Vasamegam, established diabetes going towards insulin, ketonuria actually. Majja is also a type of ketonuria with UTI. Kshaudramegam, Madhumegam, Ojomegam are established diabetes. I think sometimes these 20 pramegas are 20 stages of the same disease called a diabetic syndrome. And we miss it because we don't do Mutra Pariksha. It is a spectrum starting from Kapha to Pitta to Vada, Avarana to Dadukshaya, Sandarpana to Avadarpana, Stula to Krisha, Kledam to Ruksham, drugs to insulin. This is a one way of thinking. Other thinking, according to Susruta, they appear as separate entity. That is why Susruta told 20 kashayas for 20 pramegas, which needs lot of research, and there is a great scope for research. My PhD work is microalbuminuria in diabetes mellitus. It took 8 years. We gave Aragvadam, Kathakam, and Yaganayagam. It was an extensive study, and it's effective. The control group were taking metformin and ACE inhibitors, Ramipril. That itself is a 2-hour presentation, albuminuria. Vagbada added Swedam in the Dusha, which is not added. Why this is important is, in Vadaraktam and Pramegam, Swedam is contraindicated. But we do Swedana, Pirichal, etc. for Utkleshana purpose. And in the later text, there is a reference that women will not get Pramega because they have periods. Some things have changed, because Raktagulmam Sugasadhyam Puranatvam ja Sugasadhyam te Lakshanam Pramege Tulya Doshada Raktagulmam Puranatvam Jware Tulya Doshada Pramege Tulya Dushyatvam Raktagulmam Puranatvam to Sugasadhyam te Lakshanam. There's a very, very big if Pitta Jwaram in a Pitta Tulya Doshada Kafam and Medas. Raktagulmam Puranatvam is Kashtam. Raktagulmam actually, Raktagulmam, some others say it is molar pregnancy. Gayadasa wrote a commentary called Nyaya Chandrika, and he says it is not correct. I often doubt the reliability of yogas mentioned in Vaishyajaratnavali, because exaggeration cannot be a part of medical science. Neeli Brungadi Kaila Paathu Theina Enna Kaila Mudi Valandronna. அந்த மாதிரிலாம் மெடிசின்ல சொல்லக்கூடாது. தேவர்கள் பூமாரி பொழிந்தனர், ஆம் ஆம் என்று ஒலி எழுப்பினார்னா எந்த தேவர் சத்தம் போட்டு இருக்கான்? மகாதேவன், நான் தான் சத்தம் போட்டு இருக்கேன். Vangabhasmam, Nagabhasmam, Abragabhasmam, Shilajit, Swarnamakshigam. Swarnamakshigam is described same as Shilajit. Shilajit oru tulam, 4 kilos you have to take. 4 kilos of Shilajit, you imagine. The total millets. All these millets, Sirudhanyam, 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 we talk. But these millets are told as a Nidanam in Prameham. This needs a discussion. Finger millet, Sanva, all these little millet, Baragu, foxtail millet, Kodo millet, எல்லாம் சிறுதானியங்கள். குதிரைவாலின்லாம் சொல்றான் பாருங்க. The patani, green peas grame, harenu, அது நிதானம். இந்த சோளா பட்டூராக்கு அதுதானே கொடுக்குறான். பட்டாணி கறிக்கு பேர் என்னது ஹோட்டல்ல கொடுக்குறானே? மட்டர், ஆலு மட்டர். நிதானம். மாஷம் நிதானம். இட்லி தோசை எல்லாம் போச்சு. வைத்தியநாதன் சார் used to say don't take idli and dosa. Vishwanath Sharma used to say don't take coffee. When somebody comes, he writes no coffee, no tea. Then he will ask what is your name. அது மாதிரிலாம் பெரியவாங்கள் இருந்திருக்காங்க சில ஆகாரங்கள்ல. வைத்தியநாதன் சார் இட்லியை பத்தி சொல்லும் போது புளிப்பு புளிப்பு புளிப்புன்னு சொல்லுவார். The fermentation is a cause for amam, you know. Amam is a fermented thing. It is Ushna Snigdham Abhishanti, Ulundu. Woman can take it for Garbhadanam. Genetic predisposition, Bija Dushti, is told. Garbhaja origin, gestational diabetes, told in Sharaka Sariram. Panduvarnam, Shaudravarnam, Asamegam, albuminuria. All the Vadamegas denotes diabetic syndrome with nephropathy, with or without UTA. That's the conclusion I am giving. Diabetic syndrome, all the four things. Always that's why I tell insulin is a kapha hormone, glucagon is a pitta hormone, stomatostatin is a vada hormone. The end stage, total destruction of beta cells happen. That's why we supplement insulin. It's a supplementation therapy. Vasamegam, Majjamegam, cast, CAST. ஒரு ரெப்பு வந்திருந்தேன், ஒரு ப்ராடக்ட் எக்ஸ்பிளைன் பண்ணேன். என்ன காஸ்ட்னு கேட்டேன். உடனே ஹிந்து நாடா இருந்தேன். அதை கேட்கலப்பா, மருந்து விலை என்னன்னு கேட்டேன். அப்படிலாம் இருக்கு. Shaudramegam. See the Lakshanas. Mutravaga Srodo Dushti in Pramegam, Prabhuda Mutrada, Avila Mutrada, Udagavagam, Pipasam, Jihva Gala Talu Sosham, Mamsavagam, Pudi Mamsapitaka, Kaye Malam. Karabada Dagam is told in Pururuba in Ayurveda, diabetic neuropathy. Medovasrodas, Snigda Pichila, Gana Gatrada, Svedam, Dandadina Malatyatvam, Majja, Netra Gauravam, Murcha, autonomic neuropathy, retinopathies, Sukravagashrodas, Daurbalyam. Diabetic people, erection will be less. There will be atherosclerosis in the penile artery. So, Aparipakva Dadus, beautiful concepts. Bahu Drava Kafam, Bahu Abadda Medas, Bahu Asamhida Medas, Kleda Dushti, Aparipakva Dadus, Dadu Shaidilyam, Dadunam cha Saidilyat. Pramegam and Pandu. Dadu Vriddhi, Dadu Kshayam, Dadu Bhagam, Dadu Dushti, Dadu Saidilyam, Dadu Asamahatvam, Dadu Astiratvam. இவ்வளவு துஷ்டி இருக்கு தாது. தாது விருத்தி ஸ்தௌல்யம். தாது க்ஷயம் அது மேகம். தாது பாகம் ஆட்டோ இம்யூன். தாது துஷ்டி விருத்திக்ஷயாத்மகாக கிரகணி. தாது சைதில்யம் disintegration of muscle protein, diabetic. Then Dadu Asamatvam, Shofam. Dadu Prakriti Stiratvam is Unmada Nivarti Lakshanam. Astiratvam is Dadu Dushti. Dadu Astiratvam. Bahudrava Sleshmam, Sharira Saidilyam, Kleda Dushti. Maduram Sandarpanam, Amlam Vishyandam, Lavanam Sangadam retention. These three increases kapha. Kapha affects mutra. Bastisthana prameya. So this Tatradya Marudan Grandhi is not a ordinary thing. Agni, I often think why in Prameha chapter Agni is not very well elaborated. Actually, in Charaka, there is no direct reference about Agni. But pathogenesis quite suggestive of Agni Mandhyam. Agni Pati onnu perisa cholale. But Susrudala irukku. Aparipakvam. The word aparipakvam is there. Vadavitta kafam, kafadushti, rasam, raktam, mamsam, medas, asti mattum illai. Vasa, lasiga, ambu, medas, mamsam, kledam, swedam, mutravagam, medovagam, budagavagam, mamsavagam, adipravarti, vimargagavanam, sankam, amasayam, udbosthanam, mutramarkam, madhyamarogamarkam, dadvagni mandhyam, chirakari. So we use polyunsaturated oil, Ushna Snigdha. That is why Grida Snegam is not given. Sarshapam, Atasi. Now they talk about omega 6, omega 3 ratio. Priyangvadi Ganam Pittam, Surasadi Ganavasti. All the Pramegis, they have constipation. Durvirejan Marana. Apo Padola Muladi, Padola Kaduroginyadi, Misraga Snegam. Nisha Katakadi for Pitta Kafam, Kataka Gadiradi, Kafa Pittam, Aragvadadi, Kevala Kafam, Negrodadi, Kafa Pittam, Vatsagadi, Kinjit Kadu, Asanadi, Kafaharam. Asanadi and Vatsagadi with Logam is called Ayaskridi. Yogaratnagaram, so many medicines are there. Palatrikadi, Vidangadi, Palasa Pushpadi, Akulyadi, Panchanimbadi, Navayasam. Navayasam Vyoshagni Vela Triphala Musta Tulya Mayorajaihi. 9 items. Iron. Navayasa Logam. 9 items Gugulu. Navaga Gugulu. Madhusnigi Yogam is also of Bhagandra Prakarana is same yoga. Except for Gugulu, we add Madhusnigi. Triphala Guduji, Nishamalaki and all not very effective in Pitta Pramega. That is Amlarasam Tikta Kadu actually. Karkadi Bijadi Churnam, Chandra Prabhavadi, Shiva Guliga, Niruryadi Guliga, Pullanji Ver. My Guru, one day night 6:30, he took me by an auto to a place. and showed Pullanji ware. Nerurium. நான் கேட்டேன், எதுக்கு சார் இந்த ராத்திரி நடுராத்திரி என்ன கூட்டிட்டு போய் செடியை காட்டுறேன் சொன்னாரா. இதை சொல்லித்தரத்துக்கு அப்புறம் உனக்கு ஆள் இருக்க மாட்டாடான்னார். நெக்ஸ்ட் இயர் he died. அந்த கமிட்மெண்ட். ஒரு குரு took an auto, took his Shishya before sunset to a corner and showed this is Neruriadi Pullanji ware. அதே மாதிரி ஒரு ரேர் ஸ்பீஷிஸ் ஆஃப் தத்தூரா அதுக்காக போனோம் நாங்க. எல்லாம் கற்பனையா கதையா போச்சு. வருஷங்கள் ஓடி 22 வருஷம் ஆச்சு. நெரூரியத்துலதான் அந்த ஏகநாயகம் வருது. பொன் குரண்டி வேருங்க மலையாளத்துல. அது தோய கல்பனை. கேரளால தோயம்னா திருவேண்டரத்துல இருக்கும்போது கதிரா ப்ராசஸ்ட் ஆயில் வாட்டர் தே கிவ், கருங்காலி வெள்ளம். அது கஷாய ரசம், சீதவீரியம், ரூக்ஷகுணம். அவிபத்தி சாப்பிட்டுட்டு கஷாய ரசம் அனுபானம் பண்ணினா எப்படி பேதி ஆகும்? How will you go to the toilet? Neruriadi guliga. Gudam is kleda vardhanam, so legias are not told in jora chikissa, pramega chikissa. But Kusavalegam, Sala Saradilegam, Punga Pagam, Yoga Ratnagara says Ayaskriti, Madhvasavam, Lodrasavam. But Madhvasavam does not contain Gudam, it contains only honey. Balladagasavam, Devadarasavam, Logasavam, Dhanvantara Gridam contains Balladagam, Dadimadi, Mahadadimadi, Yoga Ratnagaram, Trigandagam, Simhanadagradam, Nisho Ushiradi Thailam. Nisho Ushiram Kashayatil Yeladiganam Kalkam. Vasanta Kusumagaram, all these things are told. Swarnamakshigam, Bagumutram. In night urination, Venu, bamboo leaves dried kashayam is very effective. The person should walk, that is 100 yojanas. He should walk 1500 kilometers. Walking. American Heart Association says 150 minutes in 7 days is minimum walking score. Somebody follows 10,000 steps. They should cross the ponds, move with cow, drinks cow's urine. In a particular community, once I wrote Gomutrasavam, which is called Chitrakasavam, and Panchagavyam by the concept of Vipran Gurun Karshayadam Papam Karmacha Kurvatam. Unknowingly, not intentionally. And they got very upset that I gave a medicine made up of cow's urine. That is also a lesson I learned. This Panchagavyam, Gomutrasavam, Gomutra Haridagi cannot be given to all, because while telling the Lashuna Rasayanam, Shastra says you should not give Lashunam to Sannyasi and Brahmachari. These types of problems Vagbada also faced. Bimbi, Amalaki, Karavelagam, Nimbam, Kadiram, Haridra, Guduti, Mesashringi, Mediga, Bilva, Babulam, Tok, Katakam, Avartagi, Avare, Saptachakram, Goa, Nitya Kalyani, Koya, Ilai, Goa leaves reduces sugar. Yava, very good for diabetes. Guru Avatarpanam, that is low glycemic index. Guru Avatarpanam, you take the food, stomach is full, but sugar will not increase. That is Guru Avatarpanam, that is called modern medicine glycemic index. And diabetic nephropathy, usually it starts with microalbuminuria. It should be less than 30. 30 to 300 is micro, greater than 3 grams is macro, then creatinine will increase. Now the score is changed. For women, it is up to 0.9 only. Men, it is 1.2. But when it reaches 1, already 40 to 50% of nephron gone. So in the diabetic nephropathy, controlling the sugar, controlling the BP, controlling the cholesterol, regular walking, frequent monitoring, diet control, and start with Aragvadadi Kashayam and Shiva Gulika, and then give Dhanvantara Kritam Shamana Snegabanam, then give a Patola Muladi Verejanam, and then for maintenance, give Aragvadam Katakam Eganayagam. Don't use Shilajit, don't use Abragavasma, Nagam Vangam Mesadam, avoid. Shilajit, good Shilajit is not available. So this medicine, in my experience, for a Stula Degi, Aragvadadi Kashayam is very effective. In Krishadegi, Dhanvantara Kridam, Trikantaka Kridam with Kashayam is effective. So in fasting sugar, you try to keep it below 100. Actually, below 100 is the fasting for a healthy person. 100 to 126 is called impaired fasting tolerance. Greater than 126 is called diabetes. 140 to up to 140 is the 2-hour postprandial. 140 to 200 is called impaired postprandial tolerance, which is called IGT, impaired glucose tolerance. More than 200 after eating is called diabetes. Other things are called pre-diabetes. Usually 75 grams of glucose is dissolved in 300 ml of water, and sugar is taken half an hour, 1 hour, 1.5 hours, 2 hours. Extended GTT, we take up to 3 hours in gestational pregnancy diabetes. You have 50 grams GTT, 75 grams GTT, 100 grams GTT. Fasting should be less than 100. Postprandial 1 hour should be less than 170. 2 hours should be less than 140. HbA1c is never a diagnostic tool. HbA1c is not for diagnosis, not for diagnosis, not for diagnosis. It is for prognosis. In a known diabetic person, how far the control is. We write HbA1c. Even though HbA1c plasma half-life 60 days, RBC lives for 120 days, half is 60 days. The cellular recording of the membrane is mostly decided by the food you take in the last 15 days before the test. So HbA1c also variable. That's why now they have got a new test for control of sugar in 15 days, which is called fructosamine. And fasting insulin is taken. In diabetes, insulin, type 2 insulin will be high. In type 1, insulin will be low. In C-peptide, low type 1, high type 2. So in young diabetes before 25 years, write insulin C-peptide. Microalbuminuria less than 30 milligram, 30 to 300 microalbuminuria, diabetic kidney disease, where Asanadi Kashayam, Shivaguliga, Daru Haridra Toya Kalpana, Dhatri Palasevana, Haridra Churnam, they are found to be very effective. Aragvadadi and Asanadi are the best known available medicine. Water processed with Daru Haridra are highly effective in microalbuminuria state. When it becomes nephropathy, you go to Guduchyadi, Punarnavadi, Pachanamradam, Narayana Churnam, Duktavadi, Dasamula Haridagi, Ayapatra Punarnava, like that. Vyoshati Takram. That is nephropathy. Now it is microalbuminuria. Diabetic nephropathy, hyperglycemia, hypertension, smoking. Smoking is Kadu Tiktara Kashaya Rasa, Ushna Virya, Kafahara, Vada Vardana, Pitta Vardana, Vidahi, Pramadi, Ojo Nasana is equal to cigarette. நான் ஒரு poet ஒருத்தன் எழுதினான் சிகரெட்டை பத்தி ஒரு கவிதை எழுதினான். சித்திரப்பெட்டியில் சிகினா படுக்கை, நித்திரை கலைந்ததும் நெருப்பு நீராட்டுன்னு. அந்த சித்திர பெட்டி, அழகான பெட்டிக்குள்ளதானே சிகரெட் இருக்கு. சித்திர பெட்டியில், சிசர்ஸ் படம் போட்டு சித்திர பெட்டியில் ஜிகினா படுக்கை ஒரு வெள்ளி தாம்பாளத்துல இருக்கு. நித்திரை கலைந்ததும் நெருப்பு நீராட்டு. அப்புறம் சொன்னா உறவுக்கும் நட்புக்கும் பாலமிடும் கலைன்னு. முன்ன பின்ன தெரியாது சார், சிகரெட் கொடுங்க சார், தீ அந்த தீ இந்த தீ வாங்கி வச்சுப்பான். உறவுக்கும் நட்புக்கும் பாலமிடும் கலை. அப்புறம் சொன்னா புற்றுநோய் உறையும் பாம்பின் கோட்டைன்னா. இந்த அற்புதத்தினுடைய தமிழ் வார்த்தை இருக்க புற்றுநோய், புற்று. ஒபிசிட்டி எல்லாத்துக்கும் ஒபிசிட்டி தான் காரணங்கிறான். நால்பாமராதி கஷாயம், ஆல் அரசு அத்தி இத்தி, வெரி எஃபெக்டிவ் இன் டயபெட்டிக் மைக்ரோ ஆல்புமினூரியா. வத்சகாதி, அசனாதி எங்க கொடுக்கணும், வத்சகாதி எங்க கொடுக்கணும். அசனாதி திக்த கஷாயம், வத்சகாதி கஷாய கடு, அசனாதி சீத வீரியம், வத்சகாதி உஷ்ண வீரியம். வத்சகாதி இஸ் லேகனம், தீபன பாதனம், சூலக்னம். அசனாதி கஃபகரம், வத்சகாதி வாத கஃபகரம். வத்சகம்னா இந்த கணங்கள் எல்லாம் நல்லா படிக்கணும். அசனாதி, நிஷாகதகாதி, ஆரகுதாதி, வத்சகாதி. நெக்ரோதாதி சூர்ணம், வெரி எஃபெக்டிவ். அஜாஜி பாடாதி எஃபெக்டிவ். கதிராஜல பானம் effective. Polycystic kidney disease runs in family. Autosomal recessive. People with polycystic kidney get aortic aneurysms, brain aneurysms, cyst in liver, diverticula of colon. So people with polycystic kidney, when they have headache, you have to check MRI to rule out berry aneurysm. Berry aneurysm and ventricular fibrillation, tachycardia, ventricular arrhythmias are the causes of sudden death actually. Abdominal pain, blood in urine, drowsiness, nail deformity. Without test, how will you find there is polycystic kidney disease or IgA nephropathy? நாடியில எப்படியா கண்டுபிடிப்பேன்? நாடியில IgA nephropathy எப்படி கண்டுபிடிப்பேன்? Polycystic kidney disease. BP needs a debate. CT never writes CT always because radiation is there. MRI there is no radiation. Intravenous pyelogram, which is done by radiologists and urologists. Family history of polycystic kidney disease. Check whether they have headache. Then bedwetting, chaya mootram. குழந்தை ராத்திரி ஒண்ணுக்கு போறதுன்னா mother is anxious. மதரும் கிராண்ட்ஃபாதர் அண்ட் கிராண்ட் மதர், தாத்தா பாட்டி படுக்கையில இஸ் பாசிங் யூரின் இன் தி பெட் போனான். It will automatically, most of the cases, they recover. 12 மணிக்கு you keep an alarm, take the fellow to bathroom, ask him to urinate. Then 3 o'clock, another alarm, take him. Don't give water after 7 o'clock. Kashyapa talks about it. Bhava Mishra talks about it. Bimbi Swarasam is the Agre Aushada for bedwetting. Shaya Mutram. Only thing you should not miss spinal cord lesions, diabetes type 1 and spina bifida occulta, meningocele, etc. Bimbi Moola Rasam, Vaishajaratnavali. TB of the bladder. TB actually comes, extrapulmonary TB comes in kidney and then it transmitted to bladder. Prostate gets TB. We have diagnosed a case of prostatic TB. The man came with pain after sex, burning. He was afraid of sex. He was afraid to go to the partner. We evaluated and somebody treated him for chronic pelvic pain syndrome and reflex sympathetic dystrophy, which is called prostatodynia. We evaluated TB Ferron, AFP, urine 3 days, morning fasting sample, Manto. He treated with ATT by the help of a urologist and he was completely cured. We have seen endometrial TB. He treated, they become pregnant. Hydronephrosis, Udavartam, Mutraja Udavartam, structure, stones, tumors, birth defect. You see this? Swollen. The urine will go back and the kidney will swallow, will become swollen. So Kadurasam, Ushnam, Sofagnam, Lekanam, Srodo Shodhanam, Anulomanam medicines are selected. You should not select Gotshura here. You should select treat like Gulma, Varunadi, Cheravilvadi, Chandraprabha, Aviltolam. Aviltolanna Pudi Garanjam. Gudardraga Prayogam, Hinkuvajadi, Pipalyadi Anuvasana. Mutragada Chikissa, Srodo Rodagara Chikissa, Udavartagara Chikissa, Kafavadagara Chikissa, Ushna Ushadas. Ushna Ushadas, Kinjit Ushna Ushadas, we will not give in Mutra Rogam usually. Lekana medicines, Lekaniya Ganam. This is how Gudardragam is done. It's a wonderful Rasayana. You should practice it. Gudardraga Rasayanam, it's directly available, I think, in AVN. Madurai, they are making Gudardragam. You can make it in the home. UTI. UTI is Vata Pradhanyam can come in stone, Pittam infection with fever, Kapham prostatitis. So it is a Sama Rasam in Mutram. Amam plus Mutram is infection. So Tikta Rasa medicines are given. Guduchiyadi, Chandanadi, Chandanadi Vadi, Kadakagadhiradi. 7 days with Madhu. Saptaratra Prayogam. You give Kadakagadhiradi for diabetes. Will 7 days, will it be cured? The greatest thing I want to talk is how will you approach a diabetic case? Suppose somebody is coming to you with 320 postprandial. Will you treat that 320 by giving tablet A, tablet B, Nishamalaki, Asanadi, Kadakagadhiradi, like that? What is the rationale? Or will you approach a case of Pramega as Bhagudrava Kafa, Bhagu Abadda Medas, Kleda Dushti, without checking the sugar, because Susuda did not check sugar. Suddha Ayurveda people say. Charaga did not have a glucometer. So, which approach is correct? This is a thing I want to debate along with hypertension at the end. Already we have another 300 slides remaining. Today is the 4th class of nephrology. Then nephrotic syndrome in children, adult nephrotic syndrome also there. Protein in urine, swollen, high cholesterol, children, nephrotic syndrome, very high triglycerides. They may get risk of clot. BP will increase. Glomerulonephritis is very common in adult. See this? Nephrotic syndrome. Nephritic is pyelonephritis. Seizures, I have seen seizures. Cholesterol will be very high. Biopsy may be needed. ANA, cryoglobulins, complements. In SLE, complements C3 and C4 will be low. Rheumatoid and lupus nephritis, we have to rule out. Iron. Nephrotic syndrome, you treat like Kapha Prameha. Punarnavadi, Guduchadi, Santanadi Vadi, Shivagudiga, Gudardragam, Lodrasavam. Lodra is effective in nephrotic syndrome. Lodra. Pachoti, Velliloti Pattai. Nephritic vere. It contains pus, RBC, fever, infection plus protein. HS purpura. Yanaxloin purpura. IgA nephropathy. Autoantibodies. IGA. IGA nephropathy itself is a 1 hour class. Post streptococcal glomerulonephritis. I have seen glomerulonephritis after scabies in children. We have diagnosed here in this Vaidishalaya. HS purpura is very classical. It comes in children. Blood in urine, decreased urine output, high BP. Many people do not check PP in children because they don't have the cuff. Pediatric cuff they don't have. Vision will be affected in nephrotic syndrome. You should be very careful now. Electrolytes, ANA. Sometimes large vessel vasculitis, anti-neutrophilic cytoplasmic antibody. We have P-ANCA and C-ANCA, lupus anticoagulant, beta-2 glycoprotein 1 and 2. These are all the things we check. Kogilaksham, Brigatyadi, Shatavariyadi, Vadapitta Samanam, Sudarsana Churnam, Samana Snegavanam. Analgesic nephropathy, that is painkiller abuse nephropathy. You can do Mutra Virejaniyam. If you stop the drug, 60% they will recover. Only thing, acute renal failure you should not miss. And ectopic kidney. Ectopic kidney is situated below, above, or the opposite side of the normal position of the kidney. They don't cause any problem. Incidental finding. You see the kidney is in the bottom, one kidney is there. So sometimes you get ectopic kidney. In the ultrasound, they will come and ask whether can I marry. So kidney has nothing to do with marriage. You can marry like that, you should tell. So certain issues, sodium issue, potassium issue, HbA1c issue, sexual life in a renal patient, nephropathic diabetic patient, his family life. These are all the topics I want to discuss. In my textbook also, I have written gas in clinical practice. It's a chapter. Gas. What will you do when there is no patient? That's the chapter. I have written a chapter. Because I have experienced no patients. So I wrote a chapter. What will you do if there is no patient? Then another chapter. How will you treat when a doctor comes as a patient? Because he knows something. When you ask a question, he will say double, he say the sugar is normal, BP is normal. He will never allow you to examine. So that's the chapter. Is white discharge in women a real issue? That's the chapter. So we have written different topics. Ectopic kidney can produce UTI. Horseshoe-shaped kidney, another thing. That is called renal fusion. You see this? Fusion of the kidney. They do not have any symptoms. They may get UTI. When you get UTI, you assess it. You can see it in Down syndrome, Turner syndrome. Vesico-urethral reflux may come. Kidney function test. Uric acid. High level of uric acid can damage the kidneys. Gout is a warning sign for CKD or a risk for uric acid. Common herbs what we use: Sadavari, Punarnava, Kogilaksham, Goksharam, Varunam, Ikshirasam, Guduchi, Abamarkam. Abamarkam is highly useful in hydronephrosis. Shatavari, diuretic. Punarnava, anti-edema. Kogilaksham, kidneys affected by systemic causes. Varunam, stones. Guduchi, infections. Shandanam, gonococcal sexually transmitted infection. Pashana Vedi, stones. Mutra, Virejaniya Ganam, diuretic. oliguric renal failure, hypertension, nephropathy, you can give. Vrikshadani, Pullurivi, Nattaichuri, what on that? Mangalam Badiravandina. Kusam Kasam Aringil, Itkadam. Aringil. In the synonyms irge Mutra Virejaniyam, Vada Samanam, Mutra Virejaniyam. Godu Gokshura, polyuric renal failure. Pitta Samanam, Mutra Virejaniyam, Kusam. Glomerulonephritis with dysuria. Kaphasamanam, Mutra Virejaniyam. Calculus oliguria, Pashana Vedam. Mutra Virajaniyam. Mutra Virajaniyam is actually antibiotics, antiseptics. All lotus and analpamaram is a Virajaniyam. Vadasamanam, Mutra Virajaniyam, Yashtimadu. Pittasamanam, Mutra Virajaniyam, Dadagi Pushpam. Kafasamanam, Mutra Virajaniyam is Priyangu. Gandha Priyangu, Dhanya Priyangu. Gandha Priyangu, Gardu Nyadal. Dhanya Priyangu, Gardu love birds, Podapata Thinai. Mutralam, Madurarasam Mutralam, Gokshuram. Amlarasam Mutralam, Kolam. Kashayarasam Mutra Vagasrodo act. That's which act on Mutra Vasroda. Arakvadam. Tiktarasam Mutralam. Chandanam. Lavana Kadurasam are very selectively used. Kadu we use in hydronephrosis. Varnam. Lavanam, Saindavam we use. Kudigas, Chandanadivadi, Chandraprabha, Gokshara, Punarnamadi, Shiva Kudiga. Asavarishta, Punarnamasam, Chandanasam, Uchirasam, Sarivasam. Uchirasam, Raktapitta Praganam, Saribadi, Pramega Putaka Praganam, Vaishyajaratnavadi. Gridam Sadavari, Sukumaram, Astyamayantakam, Trigantakam, Varnadi, Trigantakam is not available in the market, we have to make. Rasaushadam, Abragam, Gomutra Shilajit, Pravalam, Shara Parpadi, Swarnamangam, Vasanta Kusumaram, Suraksha Rakazisam. Rasayanam, Shavanaprasam, Sadavari Gudam, Sukumar Rasayanam, Nagabala Rasayanam. Shilajit 4.8 kilos we have to give processed with Asnadi Kashaya. Siddha, Jalamanjari, Sakasravedi, Tanganam, Borax. Jalamanjari is a very good medicine. Shilajit Baswam. Siddha use Karpura Shilajit more than Gomutra Shilajit. Kalnar, asbestos, Kalnar Baswam, Kausheyasma, Badarasma. It is told in Rasasastra. Gardakkal, Nandikal Baswam. Nerinjil Kudinir. ரொம்ப நல்ல மருந்து. சுரைக்கொடி இருக்கு அதுல. சுரைக்கொடி சித்தால எக்ஸலன்ட் டாப் கிளாஸ் மெடிசின். வெண்கார பஸ்மம், போராக்ஸ், தங்கணம். வெடியுப்புனா சுரக்ஷாரம், பொட்டாசியம் நைட்ரேட். இளநீல கொடுக்கணும் அத. படிகார பஸ்மம், ஆலம். We can treat renal failure, nephrotic syndrome, infection, stone, BPH. We struggle in acute renal failure, renal tubular acidosis, renal hypertension, tumors, acid-base issues, IgA nephropathy, renal hypertension. Ayurveda is not effective. Investigations. Now we have investigations. How to do investigation? Diet. Elaborate rendition of diet. How to give a diet for a kidney patient. See, some 150 slides are there. How to select the vegetables. Where to use Punarnava. Where not to use Punarnava. What is the Indian diet? Why Saindavam is good? What is the science behind that? Is it a myth or a reality? Lona salt, low sodium salt. You cannot use it. Why? renal tubular acidosis, very tough topic. Metabolic acidosis, bicarbonate issues, metabolic alkalosis, chloride issues, and Uttaravasti. These are all the topics remaining. We will continue sometimes later. So nephrology is a very big topic. Like this, I have plans to talk about endocrinology, pulmonology, cardiology. Cardiology, many people talk, so I don't have anything to contribute. Neurology, I started my career with neurology. Neonatology is tough. Gynec, according to Kaya Chikitsa, these are all the plans. When we called for a Vaidyanathan seminar, 4,000 people registered. Very happy to see Hema. Hema came. Very nice. She presented a lot of shirts to me, which I received yesterday, like a daughter presenting to father and guru. So with this, I conclude today's section. Today, I purposefully talked slowly because many people told me, you pour information, we are unable to follow. So I tried a slow class today. Next time, I will take a regular class. Thank you. Thank you very much. If you have questions, I can answer it.
Thank you, sir.
Thank you.
Really, the class, usually you used to speak a little bit faster, sir. I was just thinking whether you are okay or there was some issue, but deliberately you talked very slowly. That I didn't know, sir.
Okay. Many people asked me to talk slowly.
Okay, sir. So because we are not so well versed in Ayurveda as you, sir, when you talk like this, we will be able to write also, sir.
Right, I will give
took
the
some
slides.
notes.
Okay.
Sir, please explain when can we prescribe Asavarishta and Grita in Prameha? Not much used nowadays.
Gridam we use in diabetic nephropathy, neuropathy. Dhanvantara Gridam, Trikantagadi Gridam are used. Dhanvantara Gridam is one of the main Snegadravyas for Vasti and Shamana Snegabana. Asavam and Arishtam in pre-diabetic stage in obesity we can give Lodrasavam, and in Pramega Pitaga we can give Saribadi Ushirasavam selectively if the sugar is less than 200.
Okay, sir. When is fasting blood sugar more than postprandial blood sugar? When is fasting blood sugar more than the postprandial blood sugar?
Beta cell destruction type 1, autoimmune conditions.
Sir, the remaining, so one topic which you told us in diabetes, sir, one question you asked us, like if a patient comes with postprandial 300 mg per deciliter, like how would you treat it? Sir, can you pour more insight on that?
We will talk one exclusive session I am going to talk.
Yes,
is
sir.
diabetes and prameha are one and same.
Okay, sir.
How can we write? I am also writing. Sometimes I am not writing.
Okay.
Is it correct? We all have to share our ideas. Hypertension. Is Sarpagandha a solution? Shall we write Sarpagandha even after 10 years from now? Why we made slides. We will discuss. Sir. I may receive many objections and criticism. Doesn't matter.
The treatment for diabetic neuropathy.
That is not our nephrology topic. That is focal neuropathy is there, sensory neuropathy is there, motor neuropathy is there, polyneuropathy is there. Focal neuropathy is carpal tunnel. The treatment is different. Tarsal tunnel. Sensory neuropathy, Erichel Kandal. Motor neuropathy, diabetic amyotrophy, Guillain-Barré. Polyneuropathy. There are references. Only 3 yogas there are a lot of ways to treat, which I am not going to elaborate because that is not the topic today. 3 yogas mentioned for neuropathy in the text. 1, Ashtanga Hridayam Kushtam, 3rd sloka. Dashamula Mesha Sringadi Kashayam. Dashamulam, Mesha Sringam, Amurdam, Sargeshtam. Thiruvattapasai. ஒரு யோகம் நிரோபதி. வாத பிரமே, வாத குஷ்டம், காபாலம். அப்புறம் 80 ஸ்லோகம் கழிஞ்சு அடுத்த ரெஃபரன்ஸ். பூனிம்ப நிம்ப திரிபலா பத்மகா அதிவிஷா கணா குஷ்டமேக பிரசுப்தீனாம் பரமம் சியாது ததௌஷதம். நிரோபதி. குஷ்டமேக பிரசுப்தீனாம் பரமம் சியாத் ததௌஷதம். அதுக்கு அடுத்த வரி. வரா விடங்க கிருஷ்ணா வா லிஹ்யாது தைல ஆட்ய மாட்சிகைகி. இது 2வது ரெஃபரன்ஸ். 3வது ரெஃபரன்ஸ் சரகம் சூத்திரம் 4th சாப்டர்ல. வேதனா ஸ்தாபன கணம். வேதனைனா பெயின் கிடையாது. கங்காதரர் சொல்றார் ஜல்ப கல்ப தருவுல கமெண்ட்ரி. வேதனாங்கிறதுக்கு ஸ்பர்ஷாஜானம் இத்தியர்த்தகா, சென்சேஷன் அர்த்தம். என் கீழே ஒரு ஸ்டூடெண்ட் ஸ்டடி பண்ணிட்டு இருக்கா. வேதனா ஸ்தாபன அர்க்கம் இன் டயபெட்டிக் நியூரோபதி. So these are all the things, and start with Udvartana, Maharasnadi, Dhanvantara, Mandadan, Unnavarti. These are conventional.
Okay, sir. What is the role of Agni Karma and Vidha Karma in kidney diseases such as Ashmari?
I have not done. I do not know.
Okay, sir. Sir, as far as now, I think the questions are over, sir. I think today the session was really nice, and we wish that we can ask for more questions. If you have any questions more, and we can have the raise hand option, so you can ask sir directly. Any questions among the participants? You can ask sir directly. There is a raise hand option. Dr. Varsha. Dr. Varsha, you can unmute yourself and you can ask, sir.
Thank you, ma'am. Good evening, ma'am. Good evening, sir. Sir, I would like to ask that some females tend to develop diabetes after menopause, and I have a patient, and she is following proper medication and patya, but her postprandial blood sugar is normal, but fasting sugar is high. It is around above 130, 140. But HbA1c is also normal, within normal limits. Why is that so?
140 is a normal variant for that person. It is not a big score to be worried about. If it is Avyakta Lakshanam, we wait and watch, do repeated testing, or do a Snagavanam with Dhanvantara Gradam and do a Surasadi Ganavasti. Probably you should check C-peptide and fasting insulin in that case to decide the cause.
Okay, thank you, sir. Because sir, PP sugar is quite within the normal range. Like
even fasting for a diabetic person, 130, 140 is normal if they are chronic diabetes. It's not an alarming score.
Sir, if uric acid is high in CKD, what would be the management?
Kogilaksham Pittanubandha Malashodhana Chikissa, Guduchyadi, Pachanamridam, Kogilaksham, Sadavaryadi. Like that you have to approach. Kshiravasti, Avipatti Virejanam. So Tikta Madura Rasa Aushadas you have to select. Sadavari, Guduchi, Kogilaksham, Yervaru Bijam. Like that you have to approach.
Sir, for many patients now, in our daily OPD, we see uric acid levels are higher, sir, not because of CKD.
That's due to
Usually.
metabolic syndrome,
Okay, sir.
obesity.
So we can follow the same line of treatment? Or?
Apatarpana chikitsa will reduce amapachana, apatarpana chikitsa will reduce hyperuricemia.
Okay, sir. Sir, increased creatinine more than 7. How to select line of treatment?
Already we discussed so many times polyuria, anuria and all.
After treatment, creatinine and urea came down, but uric acid is not coming low. So how can we manage this?
Uric acid also should come down logically. It is also a malarupam of pitta kapha. If it is not coming down, give kokilaksham, sadavarigridam, etc. Even if it is not coming down, do a avapitaka snekabanam and do a ruksha virejanam thoroughly.
Miss Preeti, you can ask, sir.
Namaste, sir. I would like to ask if a patient presents with hematuria, do we consider it as rakta meha or adhogata raktapittam, like mutra vaha? Also in Ashmari,
treatment
also
is same only. Vamana Mandal, who is doing Pradimargam Chaharanam, nobody is doing. Only thing, you should not mix coagulation disorders, prothrombin time, clobrogal toxicity, IgA nephropathy and all. You should differentiate painful, painless. If it is painful, patient is lucky, you are lucky. If it is painless, then you have to go for these coagulopathies, hemoglobinurias, cancer, TB, etc. Shastra, usually this question is asked, Prameham and Raktavittam. So they say, Purva Rupam is different. Lokakantasya Niswasam and all. Based on the Purva Rupa, we differentiate Prameham and Raktavittam. If that is not only Raktavitta, in Urakshadam it is there. Guro Vibhajyade Adyartam Mutram Shonidamevacha, Susruta says. How will you know it is due to long Urakshada 5 years before this fellow is passing blood in urine? These are all the references available. At one stage, you bypass all these things in clinical practice, you know. You become wiser once you see and see.
And sir, if it is possibly due to calculus, he can have hematuria even due to stones in his kidney. What would be the approach, sir?
Enamma, repeat ma.
Renal calculus la வந்து hematuria. It is possible he can have hematuria.
Painful hematuria. அது யூரின் பார்த்து அது வாதஜம் பித்தஜம் கபஜம் கண்டுபிடிச்சு வாதம்னா வீரதராதி, பித்தம்னா பிருகத்தியாதி சதாவரியாதி, கஃபம்னா வருணாதி வித் ஆவில் தோலாதி பஸ்மக்கஞ்சி. இதுதான் சாதாரணமாக நம்ம ப்ராக்டிஸில் கொடுக்குறோம். அப் டு 7 mm கேட்கறது. சிலது கேட்டாலும் திருப்பி திருப்பி வர்றது. அது ஒன்றும் பண்ண முடியாது. ஒரு 2% ஆஃப் 10, 10ல் 2 கேஸ் ஸ்டோன் போகும், அகைன் வரும், போகும் வரும். அது ஒரு ப்ரீ டிஸ்பொசிஷன். பாஷாண பேதமே கான்ட்ரோவர்ஷியல். ஏர்வா லெனாட்டாவை எடுக்கிறான் சிலவன், பத்ராவை. ஒரிஜினல் பாஷாண பேதம் கன்னியாகுமரி டிஸ்ட்ரிக்ட்ல தான் இருக்கு.
க்ஷாரம் பிரயோகம் பண்ணலாமா சார்? அந்த மாதிரி
பண்ணலாமேம்மா. பனை விரலாதி க்ஷாரம், ஆவில் தோலாதி பஸ்மக்கஞ்சி. பனை விரலாதி க்ஷாரம் ரொம்ப ஃபேமஸ் இல்லையாமா? ஆவில் தோலாதி பஸ்மக்கஞ்சி மூத்திர பிரகரணத்துக்கே உள்ளது இல்லையா?
ஓ, தேங்க்யூ சார்.
Sir, please elaborate Patya in CKD patients.
அது அடுத்த கிளாஸ் அதானே.
Okay, sir. Okay, sir. I think anybody else who wants to ask questions to sir? Can raise your hands for clearing your doubts.
I thought nephrology is a short topic. 4 classes are over. Another 2-3 classes is remaining. Then
Sir,
you think about neurology. It will take 6 to 7 months to finish.
yes, sir. Sir, is Gomutra Haritaki sufficient in patient with increased albumin and protein value more than 3000 with HbA1c 8, FBS and PPBS within normal limits, creatinine 2 and urea 42, atherosclerosis in arteries of lower limbs. Patient complains of numbness in both lower limbs.
Peripheral vascular occlusive disease it is. Gomutra Haridaki Bifa is making a Pranada tablet.
Pranada.
That is easy. A Gomutra Haridaki, if you make, it is very difficult to take. It can be given Kadurasam, Kaduvibhagam, Ushnaviryam, Kafavadagaram, Leganam. Now they found Gomutram contains erythropoietin. Erythropoietin deficiency is the cause of anemia in renal failure. So Gomutram can be given as a medicine. Mutram for Mutram. So it can be given. Latest study says it contains erythropoietin. People with secondary anemia in renal failure, they take erythropoietin injections, subcutaneous injections.
Okay, sir. Dr. Venkatesh, you can unmute yourself and ask sir question.
Good evening, sir. Myself, Dr. Venkatesh from Bijapur, Karnataka, sir. Since 1.5 months, I am treating 2 cases of CKD, sir, where one patient is having 7.4 creatinine level and one patient is having 6.3. And both patients are taking dialysis twice in a week, sir. And one patient I have started with Punarnavadi and Panchamula Chandraprabhavati, sir. But it has extended dialysis period. And one patient I have started with Punarnavadi Kashaya and Punarnav Mandura because of low HB level in the second patient. Even I'm getting good results, sir. Whether need to continue or need to change some medication.
Your approach is correct only. Only thing they are Tikta Rasa, Ruksha Guna, Kleda Sushana. You give some Shamana Snegavana like Sugumara Gridam for Apana Vayu Anulomana intermittently.
Intermittently, Ruksha Knigdha, that
in Kushta there is a reference, Mukta Rakta Viriktasya Rikta Koshtasya Kushtina. Prabhanjana Stadagasya Nasyad Dega Prabhanjana. So, in order to avoid the Vada Vriddhi, little bit in between Sneganam is needed. Your approach is correct and I am very happy to hear it.
Okay, thank you, sir.
So can we prevent renal parenchymal damage?
We can prevent by controlling diabetes, smoking, obesity, salt, hypertension, careful watching, frequent monitoring. We can definitely control Heyam, Dukkam, Anagadam. The pain which is yet to be experienced can intellectually be prevented. Patanjali Yoga Sutram.
Okay, sir. Sir, thank you so much for answering all the questions, sir. That was very nice of you.
Thank you.
Sir, I request Dr. Abhishek to conclude the session.
The session was really awesome, sir. And I'm really sorry for the inconvenience before. I like to say a Kuti story about I Ask Ayush. With a successful journey of 3 years, we conduct seminars on innovative topics with creative speakers on every Saturdays and Sundays. Saturdays in Tamil and Sundays in English at 6 p.m. live at YouTube and Facebook. We also have our recorded sessions at YouTube and Facebook. Interested candidates can visit it. And we also conduct seminars on elaborating Samhita's simplification of Sanskrit and also clinical experiences of big shot Ayurvedic doctors like this session. And we also conduct a quiz session in Telegram, which is very useful for the candidates who are willing to attend AIAP GET exams. And thank you for giving me this opportunity. And thank you all. Nandri Vanakkam.
Sir?
Hello.
Sir, நாளைக்கு கிளாஸ் இருக்கா சார் செஷன்? சார் நாளைக்கு செஷன் இருக்கா சார்?
நான் 1 hourல சொல்றேன்.
ஓகே சார். Thank you, sir.